I'm Diana. I'm one of the physiotherapists in Avanta Healthcare Private Limited. In this video, I'm going to discuss about THR and TKR and the role of physiotherapist after these surgeries. THR, it is a total hip replacement, and TKR, it is a total knee replacement. It is a surgical procedure in which the damaged parts of the joint is replaced with the articular parts that are called prosthesis. In case of THR, it is replaced by a femoral head and the acetabulum. In case of TKR, it is replaced with femoral condyles and tibial plateaus. So, in simple words, it is nothing but the articular surface where the joint meets is resurfaced using a prosthesis. So, what are the indications or the conditions which leads to these surgeries? So, the first thing is the advanced stage of osteoarthritis, rheumatoid arthritis, post-traumatic arthritis, in case of avascular necrosis, conservative treatment which is failed or any recent surgeries which is failed, and then in case of any marked deformities, in case of hip it could be a congenital hip dislocation, in case of knee any valgus or varus deformities. So what is the role of physiotherapist in this after these surgeries? So when the patients after these surgeries may deal with pain, swelling, stiffness, muscle weakness, and then it is difficulties in walking, in balance, and then some people may feel difficulties to carry out the activities of day-to-day life. As a physiotherapist, we encounter these problems and help them to speed up the recoveries by improving the range of motion, by strengthening the muscles, and then providing a proper guidance about to prevent the further complications. It can be other complications like DVT, any contractures or further deformities. And then also we provide a posture education on posture. So these are the things as a physiotherapist we will tell them to do. So what is the main goal of physiotherapy? Is to improve the quality of life with making them independent. So what happens if you don't do physiotherapy? So the patient may deal with pain, swelling. So these all will interfere with your day-to-day activities. There will be walking difficulties, even stair climbing will be a difficulty. The patient will be completely dependent upon their family members or the caregivers. So it is important to take a physiotherapy after the surgeries. So along with medication and surgery, physiotherapy also plays a very important role in the patient's recovery. So it is very important you have to take physiotherapy after the surgery for a well recovery. That's all about today. Thank you. If you have any queries, please free to contact us. We are always here to help you. Thank you.